hiccup. So this is work done at University of Chicago with the Chicago Department of Public Health, who's in charge of dealing with lots of environmental and health issues in most cities in the U.S., and then some countries at the country level have these departments. So the actual work that's done by a lot of these people as part of the Data Science for Social Good program that you've heard a little bit about, and then continued at the university. So some of you may know about lead, but if you're not living in America, lead is not a major issue in a lot of countries. U.S. had, until about 1977, pretty much every home built in the U.S. had paint that had lead in there. And in 1970-something, they passed some laws that banned lead in paint, but it was too late by that point. So why is lead bad? Well, lead is wonderful as long as it stays inside the paint, as long as it doesn't come off. But what happens is, as homes get old, paint starts chipping off. And as paint starts chipping off, kids crawl around, they pick up lead particles, put them in their mouth, and that's where bad things start happening. So lead is an interesting substance. When it goes in your bloodstream, it starts getting into your bones, and it starts basically replacing calcium. So when instead of calcium coming out, lead comes out. So pretty much all damages that happen with lead are irreversible. And the damages are pretty bad. You get IQ, hearing loss, motor control, memory issues, motor skills, all sorts of horrible issues. And then there have been a lot of studies that have shown basically that as your lead level goes up, your educational outcomes are much, much worse. So that's a study that people did. This is not an experimental study. It's they've done a lot of controlled analysis and matching, but they're showing both change in English and reading as well as math scores. Actually, there have been estimates that people have done, which basically says the amount of money, just ignore the health issues, which are the most important thing, but even if you just quantify the amount of money, $200 billion every year in the U.S. Because of lead paint in homes. So it's clearly a really important problem. So how do people solve it today? Well, we wait until somebody gets lead poisoning. So every kid is supposed to get tested for lead at some point in their life. And so today, the process most cities and states take in the U.S. is they wait until somebody gets tested and they find that this kid has been poisoned. And then they notify the public health departments. The public health department goes, inspects, so this is an inspector. They're basically going in all their costume and checking for lead paint. And it takes a few hours. And if they find lead paint in there, they ask the homeowners to fix the issue, which means sometimes painting over, sometimes replacing doors and windows. So it's an extremely important process. But the problem is when they do this, what they're doing is they're making this safe for future children in this home. The kid who just got poisoned, it's too late. So basically our policy today is that we use kids as sensors to detect lead in homes, and then we go and fix it for future kids who are going to live there, which is good because it saves kids in the future. But it might be good as well if we try to save kids today. So the goal is, starting from the premise today that inspections are reactive, to going to the place where let's prevent things from happening in the first place. And so the Chicago Department of Public Health came to us and said, we think we might be able to do better. Well, yeah. And we have some data about this. So can you guys do something to help? So what we started looking at is what data did they have? And the nice thing about, as sort of Ben was mentioning, cities have been collecting a lot of data, a lot of times for compliance purposes. So they had data for 20 years of all the blood tests that have been done on every kid. Again, they were being used to be reactive, but they had that data. They had every blood test, and it was about 1 million children over the past 20 years, and 2.5 million tests. Also, as a response to those blood tests, they would go and inspect homes. So they had 20 years of inspection data, and about 120,000 inspections, about 6 inspections a year. And the idea was, can we take all of this data and combine that with any public data we can find, building data, census data, anything else that we have, and use that to do preventative predictions? Can we predict which kids are likely to get lead poisoning and start doing interventions, start fixing the problems before they actually happen? Now, of course, if this was as simple as, you have this data, you do a join, you build a model, and you move on, we wouldn't really be here. This problem would have been solved. So, half the time, there are home inspection records. They are, in the best case, in PDF files. In the worst case, they're printed on paper. You've got all the blood tests. Yeah, they've been done over 20 years, which means that imagine the data quality over 20 years when all of this is being manually entered. At some point, it was OCR'd. And now when they do some blood tests, they type in the kid's name. The kid's name might change over time. Their address might be different. So all the usual typos, all these different issues that happen when you don't get data from a nice, clean CSV, those are the things you have to start dealing with. So the way we looked at this problem was basically set it up fairly straightforward manner. The setup was our task is to predict if a child is likely to get lead poisoning. And we have data up to now where we have a bunch of blood tests on kids over 20 years, 1 million kids. Can I build a model on kids that I have results on up to now? And then can I predict on future kids who are at risk, so up to a certain age, kids above a certain age, they're not really that risk. Can I predict on all them who are at risk and haven't been poisoned yet? So fairly straightforward setup. Next thing we do, so then we start solving this problem once we've done the setup, right? And the first step is, as is always the fun and exciting part of putting data together. And there are a lot of little nuances in this data, right? So each kid gets tested at different times for different reasons. And you need to aggregate all their tests. And the problem, again, is they have their name, it has different variations, so the usual record linkage issues where you have to merge kids with different names or different nicknames, and there's a middle name, there's not a middle name, and their birth date is there, but there might be a typo somewhere. So you do so we deal with a lot of those issues. We do a lot of record linkage and blocking, and if you know all that literature, so that we deal with that first. Second thing is what happens. It's really important to know is if an apartment building, if a flat is in the same building as other flats or apartments that have had lead, that's a really good indicator. The problem is sometimes what happens is if you have a building, one building can have 3 or 4 different addresses. So one might be 200 Main Street, 202, 204, and it kind of looks like this. And in the data, it doesn't show up as one building. It shows up as 3 different addresses. So what you have to do is you actually have to get the GIS data, and you get sort of these bounding boxes, and you have to see if they overlap. You can basically infer that they're part of the same structure, because all you care about is structure. You don't care about the actual address. So we do a lot of work there where we look at these shapefiles and try to merge buildings' addresses into the single canonical structure that they're part of. The third part is that blood tests are happening and inspections are happening. It'll be nice if there was some ID that says this inspection was caused by that blood test, but that would be too nice. So we don't have that, and so we're trying to link them based on the address of the place, so the address of the kid that was tested and the address of the inspection where it took place. And then some time similarities. So if it's near each other, they're more likely to have been caused by that. So that's the third piece of linking that we have to do in order to put the problem together. So once we've done that, now we are, in between us and building the model that we all like are these things called features, and they are not handed over to us, right? So we have to figure out what these things are. And right now we've got a couple of different types of entities. We've got this poor kid who we need to predict something about. So we've got their name, their gender, ethnicity, where they, anything else we know about them. A lot of the times that data is missing. So we have to impute gender. We have their name. We can build sort of a census tract conditional model to impute the name, the gender from their name. Same for ethnicity. Based on where they live and their name, we can impute some of those things. Then we have spatial attributes. So we know where this home is, where this kid lives. And we can have all sorts of attributes about the actual home structure, how old the home is, what the number of floors or stories are, what kind of roof does it have, what kind of walls, all that different stuff. And then we start getting data from around the home. So it started getting attributes from census tract data, and in the US there are sort of different versions. There's census data and there's ACS data that you get. So you can start getting distribution of ethnicity, distribution of income, distribution of educational. And so that we get all of that. And then we start looking at aggregations over time. So examples are, number of inspections that have been done in this census block in the past month, past year, past 5 years. Number of positive inspections for this whole same aggregation. So we start doing lots and lots and lots of spatio-temporal aggregation at different resolutions of both space and time. So we'll do block in the past month, a mile in the past month, block in the past year, mile in the past year, and aggregate over lots of kids, lots of inspections, lots of positive inspections, and generate a whole set of features. Once we've done that, we need to sort of figure out, how are we evaluating the system? What is the metric? How do we split up our data, since we do have 20 years of data? And that's something, it's obvious if you're building a real system. It's obvious because you can actually pretend that if you deployed the system early on, so let's say you were deploying the system in 2002, you can only train up to here. And then you're going to have to predict for some time in the future. And then if you're deploying this next year, you can train up to here. You can only predict the next something. So that's what we do. We simulate as if we're deploying the system at some point and do a obvious, training test temporal split. And then we keep updating to see how would this system perform in practice if we had been deployed, got more data, rebuilt the system, improved the system. And then we evaluate we have 500,000 properties, homes in the US, in Chicago, sorry. And so the resources that they have today are only based on they can only inspect, 10% of those at most, mostly 5%, sometimes 1%. So you want to evaluate not on the AUC of the entire space, you only want to evaluate your precision if you could only inspect 1% or 5% or 10%, which is a lot of the other talks in this session have also used that metric, because in most of these real resource constrained scenarios, that's really the only metric you care about. So we run a big for loop over these plus a bunch of other classifiers, all sorts of parameters, and to get a sense for, does one of them perform better than others? Are they all the same? Which ones are more interpretable? All that stuff. And we find that they all perform about the same. It's not that much of a difference. But what we find is, so this is the precision from 0% to about 10, so it's 1 to 9. This is the baseline rate, which is about 5% of lead poisoning. And we see that we're about 20, 22%. And these numbers I had to copy them from the paper, but they've kind of gone up to about 30% now. So we're about 6 times better than a baseline based on historical data if we just inspect things at the very top. What we do notice is over time the performance gets worse. So if you do the same results in 08 and pretend that you only use data up to 08 and predict on the next year, these results are better than these results. But then you notice that the baseline has also gone down. So as problems start getting fixed, it gets harder and harder to learn that function. And so your baseline goes down. So we're still seeing a 5x, 6x lift over the baseline. And again, some models do better. There's more detail in the paper. And then we look at which features are important. Like what's really causing the change to happen. And it turns out, this is the baseline. When you just know something about the child, you do okay. When you start adding the home, you start doing better. And when you start looking at data from time and aggregating over historical data, you do even better. Same over here. If you only knew about the child, just the child, you would get this line. As you start getting sort of finer and finer grained data, so if you knew about a ward, which is kind of a few blocks, and a tract, which is a smaller set, and the exact address, you start getting more and more accurate as you start getting more fine-grained data. And this is really to show cities the value of getting very, very fine-grained data as opposed to relying on very high-level aggregates. The model features are really not, the goal is not to have it be interpretable, but really the goal is to make sure that we can validate this model so that it makes sense, the features make sense. We're not overfitting on some strange thing. And if you notice, look at these features, they make a lot of sense. So, what are negatively correlated features? Basically, the richer the area, the whiter the area, the more educated the area, the less likely you are to have these problems, which is one of the main reasons why we're working on this problem. It disproportionately affects people who are not educated about the impact of lead, who don't really know enough to go complain, to get their kids tested, people who are educated tend to get their kids tested more often. They know where to go. They have resources. So that's one of the, home was built. Older homes are more likely to get lead poisoning. This is interesting. So this feature is Chicago. The far south you go, the poorer the area, and the latitude comes out as one of the predictors of lead poisoning. And then those are also pretty obvious features. So it helps us validate the results as they make sense, as opposed to just relying on the numbers only. So historical data, we can show the model is accurate. It's able to predict things at the level that makes it feasible to go deploy. But then you have to actually go test it in the field. You can't just take historical data and then assume that everything is going to work. So what we're doing right now, it's actually starting next month, is we're running a field trial with the Public Health Department. And the goal is to test a few different things. Is the model better than predicting, than using some random baseline? Is the model better than what they're doing today? And then is the model a good way of ranking the kids who are likely to get poisoning? So the plan is to, over the next year, it's going to take a whole year, we're going to run about 500 inspections to validate, compared with random baseline, compared to the top 10% of the model and the bottom 90%, and see our predictions of the model when they get inspected as accurate, I hope, as we're seeing in our offline data analysis. And then the last sort of part is, the goal of all this is to actually have an impact and change the way they do lead poisoning inspections today. And so the policy impact of that is that the first thing we're going to do is do preventative inspections. Instead of waiting till somebody gets poisoned, this model is going to be used to run inspections every day based on the predictions. Second thing we're going to do is you need time to inspect this, right? So if you find somebody at age 2 who's likely to get lead poisoning, it's probably too late. But one of the things we're doing is implementing this into the electronic medical records of the hospital, so that when a pregnant mother goes to the hospital can use it to predict, is the kid who's going to be born likely to get lead poisoning? And if that's true above a certain threshold, they can send a person over. They have 6 months, 7 months, 8 months to go fix the home before the kid gets born. So you can start preventive things even before birth happens. And then the last thing we're doing, working with them, is releasing publicly our scores, so we can aggregate over a lot of sort of homeowners who are renting to people and not fixing these problems. And the idea is to make it available publicly, a list of these landlords who have more than a certain number of issues that they haven't resolved, and we can predict are going to turn into kids being poisoned. So anyway, so this was done as part of the Data Science for Social Good program. And as a plug, I'll leave the slide up. If you're interested in any of this work, to sort of take the work we're doing at KDD and applying it to actually useful problems like we've been talking about in this room and the room behind us, come talk to me. We have lots of different opportunities to get you involved. So thank you.
So we have time for one question. One question. Oh, yes, I'll bring it.
That was great. And just, did you consider predicting the house rather than the kid?
Yep. So the first formulation of the problem was really, let's predict the house, because that's all we can inspect. And it turns out that a house can be, there are a lot more houses that are that have lead hazards than the ones that cause lead poisoning in kids. So lots of times you'll find, so if you don't have any kids, lead is perfectly fine. It doesn't hurt in most adults. So it's only an issue if you have a kid in there. And a lot of times, if you have certain habits in your home, even though you have kids, you might wash their hands very often, you might clean your floors often, it doesn't affect, it doesn't cause lead poisoning. So the idea was that if we just predicted, and we did that, we actually predicted just probability of a home having lead hazards, we got a really large list, and that was no way actionable. So we needed to reduce that list to a number that the health department go and inspect, which means prioritizing by, one, by homes that have kids, and two, by kids who are likely to get poisoning, because that's what we're trying to reduce, is not lead hazards, but lead poisoning.
Okay, so let's thank Rayid again.